All right. Thank you so much for being with us, Chelsea. Will you start by just telling us your name and who you're with?
Yeah, absolutely. And thank you for having me, Emma. My name is Chelsea Abney, and I am the executive director over at We Are Rising. I serve reasonable Oklahomans from all political perspectives who want to stand up against dangerous laws that impact the health, safety, and well being of women and girls here in our state.
So, in recent years, Oklahoma lawmakers have been able to find and allocate hundreds of millions of tax dollars for business incentives and tax cuts that primarily benefit the wealthy and out of state companies. But we can't seem to have many meaningful conversations or actions about investing in the well being of our fellow Oklahomans who need it most. So, my question to you is, what would it look like if lawmakers made a comparable level of investment in the people you serve and the programs for which you advocate?
Extreme abortion restrictions worsen OBGYN shortages and inhibit the state's ability to train new providers. 41 of Oklahoma's 77 counties qualify as maternity care deserts, meaning they don't have a hospital or birth center offering OB care and don't have any medical specialty providers. Lawmakers could use financial incentives to encourage medical professionals to specialize in maternal health. They could invest in healthcare facilities that care for people giving birth. And they could increase funding to medical loan forgiveness programs to entice doctors to work in underserved areas, especially rural Oklahoma.
Will you tell us, what are you most worried about if lawmakers don't take action on these issues? Who will be hurt the most?
So those who live in maternity care deserts are more likely to be poor. On top of that, maternity care deserts also appear to be found disproportionately in states that restrict abortion care. Women denied abortions are 3 times more likely to fall into poverty. They are more likely to be unemployed 6 months after giving birth, and they have to rely on public assistance 4 years later. In Oklahoma, 46.1% of families led by a single mother with children under the age of 5 are living in poverty. Poverty can negatively impact families and caregivers in a number of ways. As with children, adults who live in poverty experience worse health outcomes, including higher mortality rates and increased risk of mental health outcomes, such as depression and substance abuse disorders. The stress of poverty, coupled with inadequate healthcare access and limited financial resources for treatment, further exacerbates health conditions in an already stressed part of our state lacking the necessary supports and services.
Great. Thank you, Chelsea. So, last question. What would be your message if you were given a soapbox to talk to all of our state's elected officials? What would you say?
Extreme laws and lack of funding to supports and services to all the women affected by these abortion bans threatens the lives and health of women and girls in Oklahoma, and it harms Oklahoma's overall well-being in several measurable ways.
Thank you so much, Chelsea, for joining us today and for helping make the case for why state funding for populations who are suffering is so important. So thank you so much.
Thank you.